Welcome, everyone. I'm Jim Gonsoulin. I'm the owner of a wellness company for 32 years now, along with my wife, Sandra. Today, I'm interviewing Dr. Mark Freeman. Dr. Freeman is a biochemist and a medical doctor. In fact, Doc, for those of you that haven't met you before, tell us a little bit about yourself. Introduce yourself.
Well, Jim, I'd be glad to. I graduated in biochemistry, and then I went on to medical school. And I thought, how best can I utilize this knowledge and understanding of the biochemistry of anatomy and physiology, but to bring it to the people in a preventive medical way and a proactive way, so as to prevent disabilities and disabling conditions. And so then I went into preventive medicine. So my specialty is preventive medicine, and we work and we emphasize the metabolism or metabolic medicine, if you will.
But Doc, I was very impressed. I had the opportunity to visit your clinic in October, and I've actually become a patient of yours. I was very impressed with your facility and what you did there. And I know that you have a unique approach to things. So in your state-of-the-art clinic, which we're going to see more about later, tell us what it's like to visit you for the first time.
Oh, well, Jim, on our first visit, we like to meet and greet and introduce you to our staff and look at tour our facility and understand that we need to obtain subjective and objective findings, which is mainly history and physical, as well as lab work. And after we have gotten all of your health risk assessment completed, then we'll go into drawing blood. And when we get the results of your labs, we sit down for a comprehensive discussion on the results of your labs, where you are currently, where you need to be optimally, and how we're going to get there. And so that's a simple approach to how we attend to our concierge patients.
And Doc, you mentioned to me when I was in your clinic, you actually in today's technology use telemedicine. Tell us a little bit more about that. What's it mean and how do you use it?
Well, it's very good. It's actually exacerbated during the COVID crisis, whereby people couldn't meet and greet. And so we were allowed by the state boards to do a audio-visual consultation we call telemedicine. And it allows for patients that have already been established to be able to receive consultations from a remote location, from distance. And it's very convenient and very actually convenient for the patient as well, and as well as the doctor.
I know it's really effective in today's technology. And Doc, I remember you telling me and meeting your wife, Marie, you both have a medical history in your background. Talk about that for a minute.
Well, my father was actually a forensic pathologist and very well known throughout the state of Louisiana. He taught pathology at LSU. And so I come from a medical background. He was also a coroner, which actually where I learned my anatomy as I was growing up. Couldn't learn much physiology, for those corpses were not too lively, okay, if you will. But my wife came from a medical family as well. Her father is an OBGYN physician and retired physician in New Iberia. And his father was the medical physician that established the Dotrieve Medical Center and Dotrieve Hospital in the New Iberia area. And as a matter of fact, Marie, my wife, Marie, her father just turned 95 years old. So really, I got the secret for longevity from him, okay? But he's still driving, 95 years old, driving all the way to Florida to visit his daughter and participate in his granddaughter's wedding. He's still going to all the LSU football games. He even went to LA last year for their first football game, and now he goes to all the batters. So if you want to talk about longevity, I look to my father-in-law for that.
There you go. That's awesome, Doc. You know, the theme of our talk tonight, we talked about untold secrets to longevity. What is some of those secrets, if you'll share that with us?
Well, I'm gonna give you subtle hints throughout this interview. Let me just say that I feel honored and I'm excited that you invited me to interview. And I just love this community, Jim. I like the like-minded, health-conscious community of the Juice Plus community. So I'm really excited to interact with this community. But I'm going to give you subtle hints towards the secret, and maybe give you the secret towards the end. And that's the way a good novel is written, isn't it?
That's awesome. You know, Doc, it's good to know that there are some directions to good health. We talk about that often. And today, a lot of information comes out that we're not quite sure about. So I'm glad you're going to give us some hints. So as a biochemist, I know that's a unique perspective. And now a preventive medicine medical doctor, what is it that attracted you to the Juice Plus program?
That's a great question. I mean, there's two big things as a professional, a biochemist as well as a medical professional. The biggest thing is the evidence-based medicine that we practice. And so the evidence of the product line comes from the research. There's tons of research, over 45 scientific studies that have been published in peer-reviewed journals, Jim. And that really lends tremendous credibility for the people and my peers and my colleagues in the medical industry. It should be as well for everybody who's interested in optimal health. And so the product line itself is tremendous. It's a means by which you can get your essential nutrients, that essential because we need them and we can't make them on our own. We must obtain them from a dietary source. And a lot of people don't have the time, the energy, the effort, the desire to eat those macronutrients, whereby we have whole food in a capsule. So that lends to convenience and compliance. So the ability to have the convenience and compliance to attain your micronutrients, and the research is the key that brought me on board.
That's awesome. You talked about the research. It's all third-party research published, as you said, in major medical journals, and we're now above 45 studies. So are there a couple of them or particular studies that maybe caught your attention? If you will, share that with us.
Well, one of the first researches the studies that I've read and understood that really caught my eye was published in the Journal of the American College of Cardiology. It was a study that was performed in 2003 back at the University of Maryland School of Medicine, and it had to do with the elasticity of the vessels in your body, if you will, and particularly your brachial artery, which is found in your arm. They essentially showed how the brachial artery either constricted after a fatty meal or dilated after a fatty meal, depending upon supplementation. So they had three arms to this research, one of which was a placebo, which they were giving just what we call sugar pills, or a placebo, not necessarily a vitamin or anything, but it was double blinded, so nobody knew what they were taking. So the arm, or the division, if you will, that took the placebo was lent to the normal response after a fatty meal, which is actually oxidative stress or free radical damage within the arteries, which causes a reactive vasoconstriction, which means like narrowing of the hose, which disallowed or did not allow normal smooth flow of water through the hose or blood through the vessel. But they also showed another arm that took the Juice Plus fruits and vegetable blends, that it actually blunted, those that took the blends actually blunted the response, the normal response, and actually did not vasoconstrict, did not narrow its lumen, did not cause non-smooth or unlaminar flow of the blood, but actually was able to flow well. And then they had a third arm that had both the Juice Plus fruits, vegetables, and berry blend that actually lent to the phytonutrients or the polyphenols that actually showed a dilation, even a greater dilation or expansion of the vessels. And so that the blood was allowed to flow smoothly through the vessels, which actually lowers your blood pressure, Jim. You know, it's the bottom number of the blood pressure we call diastolic. That is an indicator of how elastic your blood vessels are. You've heard of atherosclerosis causing hardening of the arteries. Well, with this third arm that took both all three products of the Juice Plus trio, the fruits, vegetables, and berries, it showed not only a arrest of constriction, but also showed a dilation of the blood vessels and allowed for smoother flow of the blood, which is a tremendous. So that was published in the Journal of American College of Cardiology, which is a tremendous peer-reviewed journal.
Okay.
That
Now,
was one of the research. In order to be complete, actually, I had another study that showed that taking the Juice Plus omegas had an effect on the omega-3 index. Now, you might ask, what is the omega-3 index? So the omega-3 index in this study showed that it's the amount of EPA, which is an essential fatty acid, omega-3 fatty acid, EPA, DPA, and DHA. These are the omega-3 fatty acids that show a tremendous proponent of anti-inflammation. And it reduces oxidative stress and it reduces inflammation. Well, so the omega-3 index is how much of these essential omega-3s are in the red blood cells. And the red blood cells are tasked for perfusion all tissues, the brain and the body, with oxygen and nutrients. And these are particular nutrients that the entire body needs perfusion. And so the omega-3 index is the greatest and most accurate predictor of future cardiovascular events, Jim. It's been proven that it's the number one. There is a number two, we'll discuss that later, but the number one predictor of future cardiovascular disease is the omega-3 index. And after 8 weeks of supplementation with our essential omega blend, omega-3s, 5s, 6, 7s, and 9s, a blend of tremendous omegas, this study showed that the omega-3 index increased after only half the dosage required and after only half the time, which means 8 weeks. The full study was 16 weeks, which it showed a tremendous even increase in after 16 weeks of therapy, supplementation with the omega-3 or mega blend product. And that was a tremendous. So to elucidate the research done on the trio and the omega, which I call the quad, 2 research studies, all you need to know, it shows the tremendous benefits of the supplementation with our product line. Very awesome research.
Doc, is great. You know, as part of our community, we're very thankful for you to present that to us because we read the research as lay people and we don't necessarily understand it. Thank you for putting it in layman's terms. I know that's coming from your background and tremendous education. I know that's a real accomplishment for you. So we appreciate you doing that.
Well, I appreciate that, Jim. Let me just tell you, this has been fun. Actually, I have so long and for so much time talked in biochemical terms, talked in medical terminology. And now I'm really, it's a bit of a challenge, but it's fun. I'm really trying to learn how to speak in layman's terms and understand so that a 10th grader can understand me. And so it's actually like learning a new language like Spanish or Italian. So it's a lot of fun and I'm enjoying this. It's all about communication. You said it before, this community is all about relationships. And how do you have a relationship without communication? And so this has been a fun journey and I'm still on it and I'm loving it.
That's great, Doc. We appreciate your participation and what you contribute to all of us. You mentioned about the studies, the massive studies that we have. There's another thing I'd like to ask your thoughts on, and that's the NSF certification. How important is that to you as a medical doctor?
That's a very good question. So the NSF certification in the medical world, we would call that quality assurance, utilization review. I mean, I remember back when I was growing up, we had the Good Housekeeping seal of approval, and my mom and everybody knew that if they'd had that seal of approval, it was worthy of buying. Okay, it was a product worthy of purchasing. Well, the same thing with the NSF. It's a quality assurance group that goes around and makes sure that what you're saying, which is what's on the label, is truly in the product. And actually, they investigate the product assembly and the manufacturing and say what's in the product is truly on the label. So it's really a quality assurance thing, and it lends credibility to what we're buying is high quality, and there's no doubt, no questions.
No doubt. That's good to know as a consumer, to know that that certification is done. It's on all of our products. And it's my understanding that it's on less than 1% of the nutritional products in our country. Pretty impressive, I'd say.
Yeah, absolutely. You bet.
Doc, what is it? You talked about a lot of different areas of whole food, its importance, preventive medicine. What is it that makes Juice Plus so unique?
Well, Juice Plus is simply whole food in a capsule. And how you know what, we in medicine, we can only help those who want to help themselves. And so the issue is compliance. So a lot of people, even if you prescribe them a medication, if they're not taking it as you described or prescribed, then you're not meeting those end goals and you're not getting positive results. And so compliance becomes a grand factor. And so compliance is like, if you had things more convenient and more in less dosages and less frequency that you're taking, we were always taught, instead of prescribing something a high dose 4 times a day, you would have much better results if people can comply much more if you would prescribe it twice a day or once a day. And so in as much as we have what we need, and later on you'll find out, is whole food and healthy fats. And that's a simple approach to what the body needs, is really whole food and healthy fats. We have that in a convenient form in a capsule that you could take 2 of them twice a day, or 2 of them once a day, 1 of them twice a day, or 2 of them twice a day, depending upon your issues. And so it's what's unique about our product. It provides us the micronutrients that we need, and it gives us in a convenient form, so it's easy to be compliant, and hence we can appreciate our positive outcomes.
That's right. That's well said, Doc. And look, from your 35 years, both as a biochemist and a medical doctor, preventive medicine doctor, tell me what you see about the future of Juice Plus, the next 5 years.
Great question. Again, let me just tell you that since we just got out of this pandemic and people are all concerned about their immune system and how will they fare in the face of the public and going out, we're just now getting out and about now, and we're not having to wear our mask. So the biggest concern is our immune system. And really, in my profession as a preventive medicine physician that understands the biochemistry of the goings on of the anatomy and physiology, we actually see that the immune system, which is one part of it, as well as the endocrine system, which controls your entire metabolism. And we specialize in metabolic medicine. And so among the endocrinology, which I call the offense, Jim, and if you want to relate it to a football team, and then the immunology, which is your immune system, which we call the defense. So if you have a pumped up offense and a pumped up defense, and you're ready to go to the game, and it depends on if you get it to optimal levels and balanced, we call homeostasis, and balanced, then you're ready to go to the Super Bowl. And that's what it's all about. And that's what Juice Plus as a company can provide as a product line to allow us to pump up our immunity, to pump up our offense and our endocrinology and metabolism, to pump up our defense and our immunology, and to fight off any foreign insults, be it infectious or infestatious. But it's all about, I think Juice Plus, the company, is poised to be the product line that's whole food in a capsule, convenient to intake, and allows for greater compliance, which is the key factor in medicine, if you will.
That's awesome, Doc. That's a good prediction from a medical doctor, preventive medicine especially, for us to look at as lay people wondering, what do we do? This is a great foundation. You've done a tremendous job of sharing that tonight. And we can definitely see you're enthusiastic about it. We appreciate that.
Well, I'm very enthusiastic about it.
You have, there's more to come, but you've given us a great opening tonight about some of the secrets of living a healthy lifestyle. And we appreciate you being on with us tonight. Thank you for investing your time. I see you still at your clinic. next to your wall of fame there. We really appreciate you being with us. And those of you that joined us tonight for this very special event, look forward to some more events with Dr. Freeman coming up in the future. How many of you like to see that? So thank you all for being with us, and we'll bid you a good night.
Hey, Jim, before we go, let me just give you some parting comments. I
Sure,
haven't
I'm
really
sorry.
laid out the secret that my father-in-law kind of, ingrained in me. And that secret really is simply put, as we said earlier, I elicited to it subtly earlier, but it's whole food and healthy fats. And the Juice Plus product line gives us whole food in a convenient capsule, and healthy fats, a blend of omegas in a convenient capsule. And so really the product line lends to our secret for longevity.
That's awesome. Thank you for making sure we covered that, Doc. I got so excited I was about to cut it off. So thank you for sharing that. And again, folks, you'll get more in the future. And all of you who are on tonight, we appreciate you being with us, and especially Doc and Marie. Thank you all for staying at the clinic and sharing what you have tonight.
You bet. We still have some Nexus letters to write for our veterans.